So today we're talking about preventing acupuncture bleeding therapy, some advanced infections. So in ancient time, for acupuncture, we have 9 different kinds of needles. So you can see some needles made pretty thinner, like this one. Yeah, this one is kind of thinner and not too long. So that's the needles right now we use. Filiform needles. Some needles pretty bigger. So like this one. So these needles, right now we are not that commonly used. And also these needles were not that commonly used. So basically these kind of bigger needles we use like a patient have some problems, like locally some pus in there, then try to relieve it. Or maybe in abdominal area, we have some fluid in there. We try to relieve it, use these kind of bigger needles. So that's like abdominal bigger body, but a lot of fluid inside. So thinking about Chinese TCM is kind of 3,000 years, even longer. During that time, we don't have modern medicine. So TCM can treat any kind of conditions, like including some surgery kind of conditions. So that's why we have 9 different kinds of needles suitable for different kind of condition or situations. Some needles maybe we still use, but maybe the different way we used. So like this one. It's kind of sharp on the top, but not that deeper. So these kind of needles later on, we got another form, the needle we call 3-angle needles. So like this one. These needles we specially use for bleeding. Yeah, we specially use for bleeding. That's right now we use. But originally we have 9 different kinds of needles in the ancient time. So 3-angle kind of needles in here, in Canada, we may still not that popular use. So that's if we try to bleeding, if only for the points, maybe we just go to bladder lancets. So we have different kind of bladder lancets. Some smaller like this one. That's not open form. And if you take off the cap, you can see a small sharp needle here. We also have some bigger one, like this one. That's we use for bleeding. Yeah, that's we use for bleeding. So this one a little bit bigger compared with this one. But the use for different part, maybe deeper one, we can use this one. So truly for bleeding, we can use different like tools. We say originally we use 3-angle needles, and we also can use blood lancets.
Doctor, are these blood lancets disposable, or we can reuse it?
Yeah, disposable. Yeah, that's disposable. One-time use. Yeah,
Okay.
this one and this one. Yeah, just use one time for one patient, and then similar like needles. Yeah, similar like needles. You can see on the box they have 200 here. This one usually it coming 100. I don't know how much it costs, but it's not that expensive. Yeah. So
and usually, where can we buy? Where can find these needles to buy?
I think I didn't truly buy it on the market here. Like Easter curtain, you can order it. You can try to find, go to pharmacies to see if they show it. I didn't truly go to there to looking, but they have, right? Okay. Because I know like some diabetes kind of patient, they use the every day. Yeah, they test the blood sugar levels. Yeah, pharmacy. Yeah, go to pharmacy to looking. Yeah.
Okay, thank you.
Yeah, you're welcome. So that's we're talking about bleeding. We can use different kind of tools. Even the lancers, we may directly use it. We may put in some gums. Then we use the gums cause bleeding. So it's depending where you try to bleeding and how big bleeding. If you try to more blood coming out, you use this bigger one, like the radial. If you just go to 经疗 points, you can just use this one. This cause kind of smaller bleeding there. So what we use for bleeding technique? Bleeding technique, basically we use the conditions. One is blood stasis. Like in the radio, locally some blood stasis there. We just go to locally to needle it. And also we mainly use to relieve heat. So generally heat condition, we have some common points. We can needle it, relieve heat. We have a pretty good points we call 耳尖, top of the ear. Bleeding it, we can clear some heat. And also like a bladder 40, we still can bleeding it, relieve some heat. And certainly 经疗 points, we can bleeding it, clear heat. And we have another acupoints we call 实穴, top of the fingers. We can bleeding it, clear heat. So that's generally we're talking about, we use bleeding technique, and we can use lot of conditions, like open the channels if channel got some bleeding, blocking there. And blood stasis, we know already. And relieve some heat condition, like a high fever condition. And also we can recaption, like people losing consciousness. We can, especially caused by heat condition. We can bleeding, recaption. And the sore, that's usually caused by EPI condition. EPI, wind heat condition, mainly, occasionally wind cold. So we have two pretty good points we can bleeding it to relieve sore. One is lung 10. One is lung 11. Certainly lung 11 is pretty easily bleeding. Lung 10 is not that easily bleeding, but you can needle it, treat for sore. And the local, some issue, swollen, you still can bleeding it. So clinically, pretty commonly used for lot of situations. Some people even use it for treat like a hypertension or maybe headache, but mainly caused by heat issue. Some situation we may not able to use it or be careful to use it. That's we talking about percussions. So when we use bleeding technique, similar like we use the needles, regular needles, we need sterilized. And similar like we try to needling, we need put alcohol locally first. We're still talking about 70% alcohol. Preventing some infections locally. So scraping for alcohol first, then bleeding it locally. And when we bleeding, we try not to injure the big artery. Vein is okay, yeah, vein is okay. Like in the radio, they just bleeding to the vein. Yeah, it's not truly go to the artery, but not go to big artery. Yeah, especially big artery. If we bleeding it, it may be very difficult to stop bleeding. Yeah, and cause the severe kind of bleeding problems. So don't go to big artery. Especially we have artery on the neck area, close to stomach neck. That artery, truly, you couldn't bleeding it. Yeah, it will cause pretty dangerous situation. And also we be careful, some patients, they may have like a bleeding disorder. Like they are pretty easily caused bleeding or blister. Like they hitting the table, then they cause the big blister. So that kind of patient, we try not to use bleeding technique. Because if we use bleeding technique, may cause like a patient continually bleeding, couldn't stop it. So that's we need to be careful. And also patient, if they take a blood thinner kind of medication, that's generally say basic idea with some people have bleeding trouble or problems. So that kind of patient still pretty hard to stop bleeding. So that means if we're bleeding for this kind of patient, may not that easily stop bleeding later. So that's we need to be careful, generally speaking, when we use bleeding technique. So that's the bleeding technique we talking about we use. We try like blood coming out. That kind of blood generally coming from the vein. We bleeding it like blood coming out, but it's not that truly big amount of blood. Even in the video, look like pretty much blood there, but you can see the blood stopped automatically later. It's not a truly bigger one. Sometimes we even have more bigger blood coming out, but still coming from the vein, not coming from the artery. And go to local vein, relieve stagnations. And you can see the blood coming out. From the beginning, they are pretty faster flowing. And later on, they slowly, yeah. When blood coming out, we just let it go. That's the way we relieve stagnations. And later on, like when most stagnation kind of blood go away, it will be automatically stop bleeding. Even it not automatically stop there, we just put a little bit pressure in there, they will be stopped. So that's we use for bleeding technique.
Teacher?
Yes.
If the blood stasis is in the face and we're bleeding the face, how does that look? Because the face is more sensitive, right?
Yeah, it is. Yes. If you're bleeding the face, you need you try use the pretty thin needles or lancets like this. Don't use the bigger one. Yeah, bigger one easily cause the bigger bleeding, and for the face area, we try not to cause the big bleeding. But these lancets one will be working. Yeah, will be working. Yeah, not go to this one.
Okay, thanks.
Yeah.
I have a question as well. Are you likely to get more bleeding with the 3-edged needle? Like it looks a bit bigger and thicker than the lancets. And in the video, I wonder if that's kind of contributed to him bleeding so much because it's a little bit bigger.
It is. Yeah, it is. Certainly, 3-angle needles is bigger than lancers. They cause big bleeding. So that's we pick up the different tools for bleeding, depending different part of body. Like if we go to Jingmiao points, pretty superficial there, we can just use these kind of lancers. But if you go to the body part, like on the legs, you can use either this one or maybe 3 angle needles like this. So that's basically body part vein is a little bit bigger and a little bit deeper compared on the fingers and on the face. So that's we pick up the bigger one. And certainly bigger one causes a little bit more bleeding.
And teacher, so for the children, if I want to bleed the blood around UB40, so I should do it to the vein directly, not to the UB40, right?
For children, I think your bleeding is better go to Jingmiao points, use this small one. Yeah, UB40, sometimes it's not that easy got blood. If you try to bleed in there, you still need these kind of lancers.
Oh.
Yeah.
But I have a question here. So UB40 isn't right on the blood vessel there, right? We should do it to the vein, to the blood vessel directly.
Yeah, still go to the vein. Yeah, still go to the vein. Don't go to the artery. So vein is more superficial compared with the artery. And the vein usually, you can see it. Yeah, usually you can see it. Artery is deeper, you couldn't see it. And the artery will have pulse. Vein will don't have pulse there. Yeah, make sure you're bleeding for the vein, not for the artery. That's for safety. So bleeding technique, bleeding technique originally coming from start 2000 years ago. We have recorder on 黄帝内经 灵书 part. So that's we mentions we start for bleeding technique in that time already. So basically, when we do the bleeding, we try to relieve some blood. Usually, depending what kind of situations, some severe kind of stagnations, we try to remove more blood out. And some not severe stagnations, or maybe we clear heat, maybe just a few drops. So that's totally depending what kind of different situations, and then how much blood we try to like relieve in there. So some bleeding, we can go to some points, like we talked about before, like urgent blood 40. And we can go to like a special area, like a local blood stasis area. So that's basically depending different kind of situations, we go to different part area. So that's basically we use bleeding technique to treat for the patients. Then we talking about some preventing bleeding technique may cause some troubles. So generally speaking, this one, if we follow the ruler, still the safety way, we can use it. So after we use the lancers or 3 angle needles, we directly discuss it to the sharp container. similar like the regular needles. Directly go to shaft container. Don't reuse it. Don't reuse it. So sometimes we may use, it still belong to some gums, spandrel loading kind of lancers. But we still try to like control how deeper it is and still one times use it. Don't reuse it. So that's basically we be careful after we use the lancers or 3-angle needles. Directly go to shaft container in case damage for other people's or maybe practitioners yourself. And also we're talking about bleeding. Bleeding, blood maybe carry some like passengers. Especially if patient have special kind of like virus infections, it's possible transmitted by the blood. So like we see few video already. If you do bleeding technique for others with the gloves protected of yourself. So that's we thinking about don't get some special blood infection kind of illness. And also bleeding still needles there, even bigger needles there. Sometimes maybe cause some local painful situation. But usually it's temporary. Usually it's temporary. It will be relieved later. And for patient have originally blood disorder, pretty easily cause the bleeding. We say these kind of patient, we need to be careful. They may cause more big bleeding. So that's the bleeding problems. And locally maybe blister. So that's basically we follow some rule. We try to preventing these kind of situations possible happens. Especially patient with some medications. So like make blood thinner kind of medications. That kind of patient easily cause big bleeding. So we try to like be careful. We couldn't say totally not doing, but we need to very be careful for these kind of patients. And also some patients take some hormones, that kind of medications. Maybe reaction for the needles might be more painful. So that's basically for bleeding technique. We need to be careful. So we preventing that kind of advanced infections. We still follow some like a ruler or guiding line. Then we preventing that kind of side infections possible happens. Firstly, we talk about hand sanitizer. When we do bleeding technique, we open the skin, it's a hole in there, then blood can come out. That kind of hole pretty easily cause the microorganism go inside, like a bacteria and the virus. So that means before we do bleeding technique, we need to make sure our hand is pretty clear. And we washing hand first, then put the gloves on, then we do bleeding. We protected both sides. Protected for the patient, we also protected for ourselves. And prepare for the skin. The commonly way, we still can use alcohol. Certainly you can use other disinfectants. But commonly we still can use alcohol, but you need more carefully to clear the skin there. So that's we also need ask for the patients, like the history, like some medication they take right now. And they have some disorder with bleeding disorder, like pretty easily caused bleeding. And so that's basically even some supplements maybe easily cause bleeding. So generally just ask for patient, do you very easily got bleeding? So that kind of patient, we need to be careful. Or maybe they use blood thinner kind of medication. We need to be careful.
Dr. Jin,
Yeah.
were you saying from the previous slide, you had something about NSAIDs on there. Were you saying they may thin the blood, or was that just about that they may be more sensitive to pain if they're taking like painkillers?
Easily cause blood. Yeah, easily cause more blood.
So all NSAIDs like ibuprofen and things as well? I'm just thinking that's so common, and I didn't know that.
Yeah, something. Yeah, even aspirin. Yeah.
Yeah, aspirin I knew of because it's people take it to prevent a stroke, but like ibuprofen and acetaminophen, I didn't know if it was the same.
Yeah. Yeah, basically you can just ask the patient what kind of illness you have and what kind of medication the doctor gave to you. And you can ask why you use this medication for. If anything relationship with blood problems, that will be affected mainly.
Yeah, I'm just thinking things like NSAIDs are used for like pain and things that aren't really related to blood, and they might not know that it would thin their blood. So that's good for us to know then.
Yeah, that's true. So you can ask the patient, do you easily get bleeding when like bruised? Yeah, that kind of patient, if something affected there, they are pretty easily got bruised, like they hitting the door, the next day they got a big bruise. So that means relationship with blood disorder. If not that happens, they say it's okay. I pretty easily, if I cutting my fingers, I'm pretty easily stop bleeding itself. That should be fine. Yeah.
Okay, thank you.
Then we talk about the protections requirements. So gloves we talk about already. That's basically pretty good protections. That's in case blood will be coming out. And then we talking about, we're looking for the local area. So if local area, they got some inflammations, some injuries, or some like a broken of the skin area, we are not bleeding directly in that area. So that's basically we try to looking. Yeah, we try to looking. Yeah. Yeah, some people put some share information in the chart part. You can go to the chart part to go to the link there. Lot of great information to do bleeding technique there. So we say one needles used for one patient, one lancers used for one patient also, not used for another patient. Just a single use, even one patient, we still use for one location, don't use for another locations. And then after we use, directly go to sharp container. So that's some rule we will follow for the safety. Yeah, we will follow for the safety. Then some suggestions. Sometimes we say basically when we do bleeding technique, we need to use gloves. But sometimes we also need thinking about the eye protections. So like put some protection over your eyes in case some big bleeding coming out and the blood go to your eyes. And we're talking about some requirements, yeah, like for lancers, we need a suitable treat after use, directly go to sharp container in case injure for the other people. So that's basically for our bleeding technique part and how safety for the bleeding.